Hi everyone, in this video we will be doing a 3-vector lift as well as a jawline and a thread in her neck as well. For this specific patient I chose Arte 1 threads. I'm using 18 gauge for the 3-vector as well as the jawline and a 19 gauge Arte 1 thread for her neck. To begin the treatment, I went ahead and numbed my pilot hole area with lidocaine with epi. I am now going in with a cannula and using just 2% lidocaine to numb the tracts where I'll be placing the threads. As I'm going in with my cannula, I want to make sure that I'm at the correct depth. Even though it's just my cannula, this will make your life a lot easier when you're going in with your actual thread. With the cannula, it's a lot easier to kind of go in and out and adjust your depth. When you're going in with your thread, you're not going to be able to pull back because the thread will engage. So I just want to make sure that I'm in the correct depth and plane here to start. It's going to make the thread just go in a lot more smoothly. I use the same pilot hole for all three, and I do about 0.5 of the lidocaine per track, sometimes a little bit less. I find the more fluid there is in the tract, the harder it is for the barbs to engage. So I think it ends up giving the patient a little bit of a better lift if there's less fluid in those tracts. The barbs are just able to engage into that tissue, whereas there's too much lidocaine, it's just kind of floating. So I want my patient to be comfortable, but I am keeping that in mind as well. I'm now going in with my first thread. I always start top to bottom, so I'm able to see my lift as we go. Always making sure to go all the way past the deficit so we don't end up with thread visibility. Again, I'm going to be using, my same pilot hole. I just lift that thread out of the way and then go into my next track. You want to make sure you're at the correct depth right from the beginning. You'll kind of feel your cannula pop right into that track you've created with the cannula with the lidocaine, and you can see that one just slid in very, very easily. I'm just giving it a little extra push at the end, making sure that I'm past that deficit. You always want to make sure you're past the deficit because when the patient is animating, like smiling and talking, if the thread is kind of in that area of animation, you can have it pop through. And of course, we don't want that for aesthetic reasons as well as risk of infection. So now I'm going in with my last thread for my 3-vector, getting the end right down there into that jowl area, into the heaviest part of the tissue, and giving it a nice pull as I'm taking my cannula out. Here I am checking just to ensure that my antigonal notch is in the same place where I had marked. Sometimes if you're marking the patient when they're sitting up, which I do to get the best lift, when they lay down, sometimes that area can move a little bit. So I always double check. And now we're going in with our jawline. Again, making my pilot hole, I'm using an 18 gauge needle for this. I give it a little shimmy kind of back and forth just to open up that space for my cannula to fit. And same thing as my 3-vector, I am going in, finding my correct plane and going all the way to the end and just giving some lidocaine for comfort. Sometimes it's a little bit difficult around the mouth, so you just have to give it a little extra shove there. And I retrograded out, and now we're going in with our thread. I go in at a little bit more of an angle to pop into that track, and then I try to keep it as steady as possible as I'm going and advancing, just making sure I'm staying in the same plane all the way across. Again, we do everything we can to prevent any thread visibility. At this point, I'd like to sit my patient up and see what kind of lift we have achieved. At that point, I will decide whether or not if I want to add another thread or two, just depending. For her, I ended up not adding any threads, but now we are going to be going in and doing the thread in her neck. This patient has lost a lot of weight, so she kind of had the concern that she had some loose tissue, kind of right underneath that chin area. So I was really hoping that this was going to help her achieve the look that she was looking for. So we haven't seen her back for her follow-up yet, but she looked really good walking out the door. I'm excited to see what she looks like in about 3 to 4 weeks when all the swelling and bruising goes down. If needed, we'll go ahead and do another thread. But after this treatment, I was very happy with the lift that we were able to achieve. Similar to in the face, I went ahead and I made my pilot hole. I always make my pilot hole in the neck area over the SCM, just because it's a little bit more safe to enter there. As you can see, I am still mid-dermis, so we're above any vessels here. So it's a little bit difficult to go around the curvature of the neck, but just take it slow. And as you can see, I'm kind of just slowly making my way towards that skin that we were looking to target with this treatment. Same as up in my 3-vector and jaw, I just checked my depth, and we're going to go ahead and just retrograde out with a little bit of lidocaine. Same as up in my 3-vector and jawline, I went in at a little bit of an angle to pop into that track that I created with the cannula, and then went ahead and advanced my thread just right through that track. I'm being extra careful here to make sure that I'm checking my depth all the way across. This skin is a little bit thinner, as you can see, so I just want to make sure that we don't have any thread visibility. So I am just making my way towards that tissue that we're looking to target. I want to get as close to it as possible. Once I like the placement of my thread, I just go ahead and retrograde it back along that track, and I follow along with my opposite hand just to make sure those barbs are engaging and pulling up and lifting the tissue. Now we're just going to clean her up, and I use some sterile scissors to snip the threads. I like to cut them as close as possible to that tissue so the end pops back into that pilot hole that we created. I cover the sites with just some Band-Aids. I tell my patients to leave the Band-Aids on for at least the rest of the day, and then just do a gentle cleanse that evening. For the 3-vector, I like to cut 2 at a time. I feel like I can get just a little bit closer. And we go ahead and we apply some numbing cream to her submandibular area because we decided to do just a few smooth threads to hopefully build some collagen and elastin in that area and aid in the tightening of that tissue. Like I said, this was the area that she was most concerned about, so we went ahead and we went in with some smooth threads. Before we do that, I just like to smooth out and make sure there's no barbs that I feel that still need to be engaged. I like to warn my patients that over the next week or so, they can feel what we like to call zingers, where some of those barbs may not have engaged, and if they're going to take like a big bite of food or they're smiling really big, sometimes those barbs can just engage. This is totally normal, but I do like to warn my patients about it so it does not give them cause for concern. Now we're just going ahead and going in with our smooth threads. I just used 1 pack for this area. We will continue to treat this area for the next 2 months. So I used 5 threads. This area is very simple to treat with smooth threads. You're just going straight down. You give them a 360 turn before you pull out, and it leaves the thread behind. This is great to build collagen and elastin, as I mentioned earlier, and she does have concern for this area. So hopefully over the next 3 treatments, we can really help her achieve the look that she is going for.